Hi, I'm Michelle Zuby, and I am here today with one of the contributors of our text, Dr. Templeton. Dr. Templeton, can you just give us a little background as to what you do professionally?
Sure, thank you. And I appreciate the opportunity for this conversation. I'm Dr. Kim Templeton. I am an orthopedic surgeon and professor of orthopedic surgery at the University of Kansas in Kansas City. And I am past president of the American Medical Women's Association.
Thank you. So you contributed a chapter on sexual harassment. And as we were briefly talking before, sexual harassment, I feel like it's a term everybody knows, we're familiar with. But I think you give a very a broader or even more depth, I should say, definition of what sexual harassment actually is. So for the listeners, you could go ahead and sort of dive right into what that definition is. That would be fantastic.
Okay, no, that would be great. And you're right. People do, I think, have this preconceived mental image of what they think sexual harassment is, but the definitions have changed recently and become much more inclusive. I think when most people think about sexual harassment, they think about rape or sexual assault. That is the most egregious form of sexual harassment, but fortunately also the least common. But under the term of sexual harassment, we're also looking at gender biases. That also is a form of sexual harassment. Inappropriate comments. These can be verbal or verbal or nonverbal communication. Anything that makes someone feel unwelcome or feel as though they're working in a hostile work environment. Sometimes sexual harassment can be really hard to pinpoint, but you know when you've experienced it. And I think the important thing to remember about sexual harassment is that it's based on the perception of the person against whom the comments or actions were directed, not the intent of the perpetrator. At times when this is discussed, someone will say, well, I didn't mean to say that, or I didn't mean to act that way. Well, you may not have meant it, but you did. And so even if you don't see your behavior or your comments as being harassing, again, that's irrelevant. It's how they are perceived and interpreted by the victim. And if the victim thinks that your comments or your behavior is leading to them feeling uncomfortable or leading to a hostile work environment, then it's harassment.
And as far as for victims, you've spoken a bit about how this can be damaging.
Right.
Things like burnout, career ending, even.
Right.
Can you speak a
Right.
little bit more to that? I mean, I know I've experienced it myself in the workplace in different ways, different forms, in different settings. And I can understand it from my perspective, but I think like from a bigger picture, if you could speak to that a little bit more, that would be helpful.
Of course. And again, the sexual harassment ranges anywhere from the most egregious in terms of sexual assault to comments or actions that are based on someone's sex or gender that are seen as inappropriate, or biases such as lack of professional support, lack of career mentoring or sponsorship, lack of promotion, lack of, or not having the same sort of salary that a man would and not going up in the ranks and salaries quickly as men will, lack of accommodating the fact that women have career-long societal gendered expectations. So the fact that we do 70 to 80% of the work at home compared to men. So we've got essentially two careers. So lack of accommodating that. All of that can lead to burnout or other mental health issues among women, because when you look at the core of burnout is that your values and what you expect from a workplace are different than the values expressed by the workplace. And your expectations of what you need in the workplace are not being provided, that you are not seen, you're not heard, you're not valued in the workplace. That's essentially the core of what leads to burnout. We hear a lot about resiliency training to address burnout and needing to be more mindful and needing to do yoga. None of that fixes burnout. It's a way to survive burnout, but it doesn't actually deal with burnout. And so if the core of the cause of burnout is a lack of having the same values with the people in your workplace, what better demonstration that there is a lack of correlation in those values than being in a workplace that is a source of bias or harassment? that is sort of the slap in the face that women receive, that I'm not valued here, I'm not seen, no one cares what it is that I need. What's interesting about the correlation, though, between harassment and burnout is that there's a very definite difference between genders. If you look at men who are subjected to harassment, they do have increased rates of burnout, but only if they're the primary victim, meaning if that harassment was directed toward them. On the other hand, if you look at women, women can have higher rates of burnout or risk of burnout if they were the primary victim, so the person against whom the harassment was directed, or a secondary victim, meaning that they either heard about it, they saw it, they heard something that went on in the institution. It wasn't directed at them, but was directed at another woman. My interpretation of that is, again, even if you aren't personally the victim of harassment or bias, but you hear about someone in your institution who was, that again is another demonstration that your workplace doesn't value women, and that you are made to feel as though you don't belong there.
I'm so glad that you touched on that. I think, as behavior analysts, it's something, especially in the realm of OBM, we look at values of companies and organizations. And I know now, especially in the workforce, people are looking for companies that align with their own personal values. And
Right.
we talk about burnout, and it's funny that you said, go to yoga. We're only that simple, you
Right.
know. And taking into account, you're right, like the amount of work women have to do at home. We're mothers, we're caretakers. A lot of additional responsibility falls on us. So I appreciate you highlighting that so much. Um, what do you see? Like, what can we do? Is there anything that we can do? I guess it's like a two-part question, really, but is there anything that we can do on an individual level to help balance the inequities? And then on a larger scale, as a society, or just even as like a group of people coming together to try to better the situation?
Well, I think first of all, it's understanding that if you, from an individual standpoint, that if you are a victim of bias or harassment, it's not your fault. There is a tendency to want to blame the victim, and the victim is just that, a victim. So you can't blame the victim. It's a responsibility of the person who is the perpetrator and the institution, and especially the culture of the institution in which someone works. So, from a personal standpoint, I think it's understanding that we need to support people who are victims. If we ourselves are victims, to not let that impact our risk of burnout. Reach out for help if you have been a victim of harassment. There are a lot of ramifications from that from a mental health and emotional standpoint. And so reach out for help. There is this feeling, especially for physicians, that we don't need help and we can take care of ourselves. You can't with this, and so be willing to reach out and get the help that you need. And also be willing to reach out to file a complaint, or at least let someone know what happened. And that's hard to do, and that's where institutions need to step in and provide support. But unless complaints are made, or unless awareness is raised that there's something that's going on, this behavior just continues. People that are harassers tend to be serial harassers, but it's not going to stop unless somebody knows what's going on. From a larger perspective, from an institutional standpoint, it's making the sort of behavior unacceptable. It's changing culture so that this is, so that people, whether it's male or female, whether the victim is male or female, understand that this is not acceptable and that actions are going to be taken to try to address it. Again, at this point, about 10 to 15% of women in particular who are victims complain, and with that, very little actually ever happens. And so it's changing the institutional structure so that there is a very clear reporting mechanism. That's part of the issue now, is if something happens, who do you talk to? So make it a very clear reporting structure. Make sure as part of that reporting structure that there is built within it support for the person who's making the complaint, and support not only at the time of the complaint, but all the way through that process. And then make sure that there is a process at the end. Make sure that there are ramifications for someone who engages in biasing or harassing behavior. if nothing is going to be done, then there's no reason for anyone to stop this behavior. So it's making the complaint as being so is and making that structure very visible, providing support, and then making sure that there are going to be ramifications.
Thank you. Is there anything in terms of training that can be? I know a lot of times companies will have like a sexual harassment, professional development, like it's an hour webinar or something like that, something, that everybody sort of just attends and kind of sweeps under the rug. But are there any more specific trainings that are out there that can really teach more about the values piece and the burnout and the bigger problems, the bigger implications that are out there?
Well, I think there are a couple of things that can be done. One, it is expanding the discussion of burnout and making sure that the impact of bias and harassment on rates of burnout and then related mental or emotional health issues are discussed. We talk a lot about patient scheduling and family leave, et cetera, and all of that stuff is extremely important. But I think there needs to be that larger discussion of where bias and harassment fit into that picture, because if we're going to address the increasing rates of burnout, that has to be part of whatever it is that we do to try to address things. In terms of other things that we can do, it would be getting away from the online sexual harassment training. That is not effective. And there actually is data to indicate it probably or it can make things worse, because especially people who come in perhaps with some inherent gender-based biases, can feel as though at the end of that online training that those biases have been confirmed or supported. Women in particular go into that training without biases actually have a negative impact from the training, because they're all of a sudden being faced with these biases that they may not have contemplated before. And now they're made incredibly aware of that. So one thing that institutions could do is get rid of the online training. It doesn't do anything. If you want to fix bias and harassment, then you need to change the processes to address that. But if you want to do training, which is important, but that needs to be in person, because there needs to be opportunity for discussion with a human. In person these days, obviously, meaning also Zoom meetings. It's something where there are opportunities for conversation. Don't just have it something where people, again, can have their biases confirmed or can be faced with additional biases and be upset from that. They've got to have a place to be able to discuss that and decompress those feelings. And there has to be a way that, again, that this is a conversation. It's not just clicking off a box or checking a box that you looked at a PowerPoint. That doesn't do anything in terms of changing attitudes, behavior, or culture.
So valuable. And I'm just thinking of different ways that you could take that and then ingrain that within the structure of an organization, and have these like maybe spot checks or something like that, where people are really checking in, or even self-reporting. Have you engaged in this behavior? Becoming aware of it. Because like you said earlier, sometimes the person doesn't even know that they're engaging in the behavior. Oh, I didn't mean it that way. Or, oh, I was just complimenting, so-and-so's hair or their dress or, whatever. And you just never know how those comments are going to be perceived by the person who's receiving them.
Right.
So I think that's really important.
Right. And people have to be empowered to speak up if they do see or hear a comment, or there's something that they see and they find it inappropriate, and again, it makes it feel uncomfortable. They have to be in a culture where they can speak up to someone. And again, part of that is figuring out who that someone is that you bring up those issues to.
Absolutely. And that's been a common theme too, even when we're talking about microaggressions and racism and, just being in a culture, like you said, of, within a community where you can say, that didn't sit well with me, and just have it be a back and forth dialogue and facilitate understanding, because a lot of times we don't know. We have different learning histories. We come from different places, different cultures. It's okay to say and do certain things. But if you're not of that culture, that could be taken very, very poorly.
And your mention of microaggressions, and this is so much fits in with the microaggressions based on race, and there are similar issues. If you are at work and you're constantly being faced with things that you find offensive or bias, or they're biasing you because of, or against you because of your sex or your gender, then you are constantly on edge, and it's like you're constantly waiting for the next comment or the next action to happen. That eventually is going to wear you out. You can't be trying to defend yourself the entire time you're at work, because you need to do your work while you're at work. But we've seen that in the data in terms of race, in terms of microaggressions, where there's this constant challenge to try to feel like you need to defend yourself. And you see the same thing in terms of gender.
Absolutely. No, absolutely. Um, this is so informative and so helpful. And, we, again, before we started talking, we were saying how um, it's interesting how in so much of what you said, I could see the threads of behavior analysis. And for the BCBAs out there listening to this, I think there's a lot that we can do with our skills and our science and the principles to help this situation, to work hand in hand with other people like yourself, to provide trainings, to put systems and protocols in place in organizations. And I have all the respect in the world for you diving into this project from applied behavior analytic lens, and not having that lens per se, but really just taking on that challenge. And it's been it's been wonderful to read your work, to talk with you. Is there anything out there that you're currently working on, or any projects down the line that you'd like to share, so some of our listeners could maybe follow and see what you're up to?
Well, it's funny you should ask that. Actually, I just did a lecture last week to the Department of Pediatrics at LSU about the intersection between gender bias and physician well-being. My next project is working with what's called CORD, which is a Council of Orthopedic Residency Directors. I'm the Orthopedic Residency Program Director here. I do a lot of work with CORD. I came to them with this issue of women physician burnout and mental health issues related to bias, because as your listeners may or may not know, orthopedics is about 95% male. So we do have issues with gender biases. And so in working with them, as well as another program director, Mary Mulcahy at Tulane, we've put together a online program that will be held in April. Sorry, I had to pause there because we've been bouncing around dates, but held in April. And that is looking at the bias, harassment, and bullying behavior that women in orthopedics face. Part of that discussion is going to be what the implications are for the women who were involved with this, but inviting in leadership from the various orthopedic departments around the country to find out what their experiences have been, but even more specifically asking what it is that they're doing to try to address this. And is there a way that we can share resources to find, so that no, every program is not trying to reinvent the wheel? Is there a way that we can share resources to try to help the women who are trying to go through such a male dominated profession such as orthopedics?
That's wonderful. I'm sure it's going to be fantastic and a wealth of information. If there's anything that you can email us, we can share, we can post it.
Sure.
If anybody's able to attend or interested in attending, that would be wonderful. Thank you so
Awesome.
much again for
All
your
right.
contribution to the text, for meeting with me today, and I look forward to all of the things that you have going on in the near future.
Awesome. Thank you so much.